Did you know in the early 19th century, hospitals were not places of healing? They were often places where people went to die. Disease spread easily, doctors barely understood infection, and basic cleanliness was rarely practiced. It's in this world that Florence Nightingale, born on May 12th of 1820, emerged as one of the most important figures in medical history. Florence Nightingale was born into a wealthy British family and raised with expectations very different from the path she ultimately chose. At the time, nursing was seen as a menial, even disgraceful work, largely performed by untrained laborers. Despite strong opposition from her family, Nightingale believed she was called to help the sick and devoted herself to learning medical care and hospital organization. Her defining moment came during the Crimean War, which lasted from October 1853 to February of 1856. British soldiers wounded in battle were sent to overcrowded military hospitals where conditions were horrific. Floors were filthy, clean water was scarce, and diseases such as cholera and typhus killed far more soldiers than combat wounds. When Nightingale and her team arrived at the British hospital in Scutari, modern-day Istanbul, they found death rates approaching 40%. Rather than focusing only on medicine, she addressed the environment. She organized regular cleaning, improved ventilation, ensured access to clean water, and insisted on hand washing long before germ theory was widely accepted. The results were astonishing. Within months, death rates dropped to around 2%. Nightingale proved that sanitation saved lives even when medical treatments were limited or ineffective. Florence Nightingale was also a pioneer in medical data. She used statistics and detailed charts to demonstrate how poor hygiene caused unnecessary deaths. Her work convinced the British government to reform military and civilian hospitals alike. After the war, she helped establish professional nursing education and wrote influential texts that shaped healthcare for decades. Hospitals around the world adopted her sanitation principles that remain standard today. Florence Nightingale died on August 13th of 1910, but her legacy lives on every time a hospital is cleaned, a patient's environment is protected, or a nurse is professionally trained. She didn't just change nursing, she changed the meaning of healthcare itself.